Hello, this is John Kanelopoulos from our office here in Athens, Greece. Very happy to share with you this quite interesting patient. This is a 40-year-old male we evaluated today. And what we're seeing here is in diagnosis of keratoconus. And this patient is fitted with PROSE lenses from Boston. We're seeing here he has recent history of hydrops, and we're seeing here the very remarkable and very long split in Descemets membrane. This is over 5 millimeters. It is vertical, and we can see that Descemets is wrapped onto itself on this side. We're gonna come back to this, very important point. This is the other eye, also with keratoconus, also wearing a PROSE lens. Let's go back and look at the Pentacon maps. So on Pentacon, we can see that the right eye has significant thinning. Note where the thinning is on Pentacon on that right eye. Remember, the split in Descemets is centrally, if not slightly nasally. And you can see that the posterior cornea curvature also depicts the classic position for a cone and for temporally, anterior curvature, and the very advanced keratoconus in that eye, thus the fitting with PROSE lens. This is the other left eye, milder keratoconus, but still very prominent thinning on Pentacon thickness map, posterior curvature, anterior curvature, and the dioptric map. We're going to look at the, click on the next. On the OCT images, we were unable to get a map on the right eye due to the irregularity, but we can see here this is a vertical cut of the cornea just aside and within the area that is stripped of Descemets, and we can see the remarkable scarring that has taken place there. We can also see the cornea is not quite thin, to suggest the amount of steepening that it has. So there's a discordance between the thickness of the cornea and the steepness of the cornea. This is the left eye, a similar image to the sine fluke images here with the Avanti OptiView OCT, thickness map and epithelium map. Quick note here, the epithelium is not finished over the cone because, as we said, he's wearing a rigid PROSE lens, which causes some warpage of the epithelium and is hiding the classic thinning of the epithelium over the cone on this eye. We're going to click a little bit more to look at the fitting of the PROSE lens on the right eye. And here we have the opportunity to see very nicely that Descemets split and the rolling in cross-section now of Descemets onto itself, and how the lens sits very nicely over the cornea and gives the patient a relatively good everyday function. He's functioning at 20/60, 20/50 level, even with the PROSE lenses, and these are the cross sections that we're seeing. You can see that in the horizontal cross section, it captures all the scarring from the Descemets split and roll. And again, the same images on the left eye, less action going on here, although we feel that the lens is sitting too far away from the cornea. We'll look at the Optos broad view fundoscopy that's relatively normal. We can see just the shadowing of the correction part of the PROSE lens in the Optus wide field retina exam, atrophic retina area here that's scarred. Nothing significant. And we'll go back to the first pictures that we saw. So coming back to this, this is not from keratoconus. This is not from hydrops. Hydrops usually will come from a split of Descemets right where Vogt striae were present and the cornea has stretched quite a bit. We had the opportunity to have the mother in the room when we evaluated this young gentleman, very common even for 40-year-old gentlemen that are Greek. And she did reveal that he was a forceps delivery. And when they brought our baby patient in her arms, he had a bruise over his right eye. So this goes along with what we presented over the last years. This is a patient who had forceps injury to the cornea with a very broad vertical split in Descemets membrane. Whether this contributed and made keratoconus worse in that eye, we don't know. It's been 40 years since. Obviously, the keratoconus on the left eye reveals that the patient would have keratoconus in any case, but it's very important to make all these documentations because they're very important in how we're going to treat this patient. One would say, let's go and do a cornea transplant since his cornea is edematous and is failing. One may consider here a Descemets or Descemets surgery to replace the damaged endothelium from the original forceps injury, taking that the overlying stroma would be thick enough to then sculpt and reshape with our Athens protocol, meaning a partial refraction, topography-guided normalization of the cornea, and CXL, which would be definitely the treatment of choice on him starting to be intolerant with the PROSE lenses on his left eye, which does fulfill the criteria. I think this case teaches us a lot. It's very interesting. If we did not have the mother in the room, we would be unable to get this information. I think it's a good lesson how thorough medical exam and thorough medical history and family history can help. And I thank you very much for your attention. This is John Canelopoulos signing out. Thanks so much.